Hi, what is chronic pain? That is, any pain which lasts for more than 3 months is called as chronic pain. It could be headaches, could be any sort of arthritis, slip disc, low back pain, or any sort of visceral abdominal pain, etc. Have you ever noticed any chronic pain conditions? Moments you have extreme stress or anxiety, increased pressures at work, you're sleeping very poorly, there's some family strife, etc. These chronic pain conditions, you will feel more pain during these episodes. And you think maybe my condition is getting more worse. It's actually not. That's because stress and chronic pain are directly related. Hi, my name is Dr. Roshan. I'm a chronic pain consultant here at Alleviate. And today I'm here to talk about how stress can actually make you feel more pain. For us to understand that, first we need to understand how a patient will feel pain. Whenever there's injuries or any arthritic pain, etc., there are certain signals which go towards the brain via the pain pathway, and that's when the patient actually starts feeling pain. When you feel pain, what will happen is certain stress hormones are released, like cortisol, adrenaline, non-adrenaline, etc. But your body will also have good hormones like oxytocin, serotonin, dopamine, which will help you in fighting pain. Now, a chronic pain condition, but overlap that with increased stresses at work, some financial problems, you have marital problems, etc. Your bosses yell at you, etc. So what will happen is your stress levels now will start increasing. What happens when your stress levels start increasing? Same thing, your cortisol levels will go up in your brain. Your stress hormones like your adrenaline, noradrenaline, they also tend to go up. When you combine stress and chronic pain, what will happen now is your body's ability to fight pain will start coming down. So there's going to be an imbalance. Your good hormones, which are like your oxytocin, dopamine, endorphins, will start coming down. Your stress hormones will now start going up. So what does stress make you feel? You actually feel more pain. Your body is not producing more pain. You are just feeling more pain. That there is a big difference. So this will affect a lot of things. Stress and chronic pain will affect your mood. You'll feel more angry. You'll feel more depressed. It will affect your immunity systems. Your bowel and bladder will also get affected. You have more constipation. It will also affect your sleep. You'll find many chronic pain patients saying they feel more pain in the night. That's nothing because of the increased stress levels. Now, how do you manage this? Is through biopsychosocial approach. Yes, as pain physicians and physiotherapists, we actually address the pain conditions through injections and physiotherapy, but equally important is a pain psychologist who will manage the emotional component of pain. That is extremely important. You can also do mindfulness techniques, listening to headspace apps, doing pranayama, yoga, deep breathing exercises. These are all excellent ways to manage the stress and the emotional components of pain. Over time, what you'll realize is more you manage the emotional components of pain, the physical pain levels also tend to come down. This is called as a multidisciplinary team approach. And this is what we employed here at Alleviate Pain Management Center. So if you do want to know more, please visit any of our 5 centers here in Bangalore, and you can appreciate the Alleviate way. Thank you.